gorgeous. Welcome to the 5th season of the Hormone Puzzle Podcast. I'm your host, Dr. Kayla Smith, a holistic and integrative doctor specializing in fertility and hormone health. If you're looking for insights into hormones, fertility, and all things related, you've come to the right place. Tune in weekly as we record amazing experts in the field of women's health, breaking down those hormone walls, nerding out on nutrition, and having way too much fun. Whether you're beginning your journey or you've been struggling for years, we're going to finally put those pieces of your hormone puzzle back together so that you can get and stay pregnant if that's your goal, as well as eliminate all your hormone-related symptoms for good. Are you ready? This season, we're focusing closely on fertility and hormone health with an amazing lineup of expert guests sharing groundbreaking knowledge, bringing you stories and advice that will support you in your journey. We're here to lift your spirits, give you a virtual hug, inspiration, empower you, and we want you to take charge of your fertility and your health. Thank you all so much for tuning in and being amazing listeners. So now, let's get started on your road to transformation. Let's start putting those pieces of your hormone puzzle back together one step at a time. On today's show, we have Dr. Doni Wilson. She is a naturopathic doctor, certified professional midwife, certified nutrition specialist, and best-selling author of Master Your Stress, Reset Your Health. For more than 23 years, she has helped thousands of patients overcome health challenges and achieve wellness by using specific strategies that address the whole body and ultimately resolve the underlying causes of distress. Dr. Doni suffered from migraines for over 20 years, and in the process of solving them, she developed her stress recovery protocol. Dr. Doni brings awareness to the impact of stress on our health and how it is possible to recover from burnout and become resilient to stress in the media and at public professional events. She also specializes in helping women to protect themselves from HPV, and in doing so, prevent cervical cancer. You can find her blog and podcast called How Humans Heal and her programs at drdoni.com. That's DOCTORDONI.com. Today, we're talking about HPV, fertility, and holistic health strategies to help you heal and put yourself into remission. Now, let's welcome Dr. Doni to the podcast. Hey, Dr. Doni, welcome to the podcast.
Hi, Kayla. Thank you for having me.
Yeah, I'm super excited to have this conversation. I actually get questions around this a lot. So we're going to talk about HPV and fertility and different holistic strategies around this. So this will be a great show.
Let's do it. I'm excited.
Yes. So before we do that, I would love to hear a little bit more of your story, how you got into this work, and what makes you so passionate about treating people with this condition.
You know, from a young age, I was very interested in natural medicine. In fact, I usually describe myself as a rebellious daughter of a pharmacist, because I grew up in a pharmacy. My father was a pharmacist, ran a pharmacy chain, and that meant that I really had an inside look at conventional medicine and pharmaceuticals from a young age. I also paid attention and noticed that my body really responded better when I made dietary changes or if I used natural approaches to health. And so I was taking in all this information from a young age, and I actually, from getting my bachelor's in pre-med and nutrition, decided that I wanted to become a naturopathic doctor and a midwife even at age 20. And that's, a lot of people don't figure that out. I'm so grateful that I was able to really get that clarity of, hey, this is my passion and my purpose in life, and figure that out from such a young age. And so a lot of it was also based on my own health issues. I had dealt with HPV at that age in my 20s. I was also dealing with painful periods and menstrual irregularities as well as migraines. And it wasn't enough for me to just say, I'm going to just rely on a pharmaceutical. In fact, I had side effects to birth control pills. I couldn't take them. So I was sort of in my own health forced to say, what's really going on here? Why is this happening? And how else can I deal with it? And I think that really then led me to see, because here's the thing, with my training at Bastyr University, and I completed a residency, I was really trained to work in primary care and to do deliveries as a midwife. And the thing that I found for myself, though, is that I really have a passion for helping women who are not getting helped in the standard medical system. So at one point, this was after I finished my residency and I started practice, and I had myself, my daughter, and I was really faced with, do I continue in a path of practicing primary care, offering pap smears and, the standard of medicine? And I, of course I can still do pap smears, of course, but it's like you can do a primary care, or I could decide to help women who are not getting helped in the standard care, right? Because I know women can access a gynecologist, they can access a pap smear, they can get that covered by insurance. That's available. Thank goodness. I'm glad it's available. But what's not available is helping women to finally put a stop to HPV and prevent the abnormal pap smears and get them off of that pathway of repeated colposcopies and leaps and procedures. Like, let's actually get this virus to stop causing problems. And not only that, but helping women to solve their hormonal imbalances without having to rely on a birth control pill, and how to support their fertility and prevent miscarriages, because that's another area where women are just not supported in the standard system. So along the way, I realized that I'm a person who stands up for people who are not getting served. And that's why I've really focused my work around that. How do I help in the areas where people are not getting help? So that's my story.
I love that. And it's so true. And that's why one of the reasons I started my own practice is because I saw there was a gap in healthcare, and I saw that people weren't getting the help they needed in these holistic strategies. So I love that you say that, and I completely agree. It's so needed. So thank you for the work that you're doing.
Yeah, you're welcome. You're welcome. It's really, I just feel so grateful to be able to share the knowledge I have with people who need it. And so it's very rewarding for me to be able to do that.
For sure. So let's talk about HPV. So tell us just basic definition. What is HPV?
So HPV is human papillomavirus. We speak about it as if it's a single virus, but really there's more than 150 different types of HPV virus. Some of them cause warts, like even what maybe we know of as warts on our hands or our feet. Some of them cause genital warts, which are low-risk types of HPV, not associated with cancer. And there's about, as far as we know, maybe 13 or 15 types of HPV that are associated with cancer risk. And these they're called high-risk types of HPV, are associated for women with cervical cancer, vaginal cancer, and then for men it can be penile cancer, and for both men and women they're associated with anal and oral cancer. And the numbers are increasing of people who are experiencing HPV-related cancer, both men and women, and it's, to me, really solvable. It's really preventable. It's just that in standard medicine right now, the only thing they can sort of offer is a vaccine for HPV, which, okay, that's something, but it's important to always, whenever considering a vaccine, to look at the potential side effects to a vaccine, and to know that the HPV vaccine only covers 9 of the types of HPV. So it's not a foolproof 100% solution. I can't tell you how many women who contact me who had the vaccine and are still dealing with abnormal pap smears. So I really want people to be clear that first of all, that's a myth, that's the whole solution. It's not the whole solution. And I think what can end up happening is women become hard on themselves, because when they do find out that they have HPV and abnormal cells, it's very common for women to feel embarrassed, ashamed, criticized, they even criticized by their healthcare practitioners, then they're led to believe that they did something wrong or there's something wrong about them. And so they feel very isolated and afraid to talk to anyone about it, which only worsens the situation because then they feel alone and they feel stressed and maybe then they don't take action and they don't get help. And so then too often women are then having those abnormal cells progress to cancer and even death without ever getting enough help or support.
And I'm so glad you mentioned that about the vaccine because I feel like it's really pushed in Western medicine. I have young children, boys, and it's being pushed on them. And I love to point that out that you have to look at the risk versus the reward. And the fact that it only covers 9 strands doesn't seem to be that great of a reward to me in my family. So I'm glad that you mentioned that. And so talk to us a little more about how it's contracted.
So HPV, the high risk types we get it by sexual contact. So genital contact really, because a lot of women will say, can I get it from breastfeeding? No. Can I get it from just sleeping? Like, can my child get it from me if we're sleeping in the same bed? No. It as far as we know at this point in time, it's transferred by sexual genital contact from another human. The thing is that men are not tested in the United States. Men are not screened for HPV, so men are not aware. And I believe I'm hearing from more and more men who would like to be tested. It's not that men don't want to be tested; they would like to be tested. Just medicine isn't a screening test that men undergo, and it's not available. Some countries around the world it's more available, and I do hear from men, for example, in the Middle East, who are being tested for HPV, and they then are very proactive about what can I do about this. And so a lot of times the thing is that we, of course, as humans, we're sexually active. And a lot of times we don't know that HPV is present. In fact, most all of us are exposed to this virus. This is not like HIV that's more rare. This is a very common virus. In fact, the studies show that most all of us are exposed to HPV virus by age 50. So wow. It's not like, to me, the shame should not exist because this is something that we all are dealing with. This is equal ground here. Like, we almost all are exposed to HPV. Whether you've had one sexual partner or more than one sexual partner, you still can test positive for HPV. I talk to women all the time who've been married for 20 years. So it's not, a person could have a vaccine, be married, have one sexual partner, and still test positive for HPV. So please know that if you're being hard on yourself about how did I get this, what did I do, I would say you're being a human, and humans have sex, and humans get exposed to HPV. That just happens for us as humans. We need to set aside any judgment about that and say, because when we can move past all of that judgment, then we can get to the place where we can say, how do we be proactive about this and help ourselves? Because what the studies are also very clear about is that the human body can fend off and get HPV to negative. The human body can clear HPV. Mm-hmm. Many people have heard that HPV stays around forever. You can never get rid of it. That is not true, and the studies are showing that humans can clear it. In fact, that's often why your healthcare practitioner might tell you, wait and see, right? You might get a test back that's positive for HPV, maybe no abnormal cells, and the doctor says come back in 6 months or come back in a year to retest. Why do they say that? They say that because they see that the virus is positive, but they also know the studies show that in 90% of people, the virus goes away on its own within 2 years.
Wow. So
the doctor is saying, hey, 90% of people, this is not an issue. Mm-hmm. The problem is for women, we don't know if we're in the 90% that are going to clear it or the 10% that are not going to clear it. Mm-hmm. And so we're in this worrying game for that time period. And it's as soon as we then go into, wait a minute, I'm supposed to just wait till my next PAP next year to find out if this virus caused cancer, that's very unsettling. And more women are not okay with that. More and more women are like, okay, I understand that there's some likelihood it might go away on its own, but I'm not okay waiting around. And I also am hearing from many women who are in the 10% where it didn't go away within 2 years, who've been now dealing with this virus for 10 years and having to go through more pap smears, more colposcopies, more LEEP procedures. And at a certain point, what happens is the LEEP procedure, which is to remove the abnormal cells, can cause damage to the cervix. So this then increases risk of miscarriage if a woman is hoping for a future pregnancy. And it can end up leading to needing to have a hysterectomy because of the damage to the cervix. And the thing is, even if you have a LEEP, even if you have a hysterectomy, it doesn't kill the virus. So a woman could still go back 6 months later and find out that now the virus is causing abnormal cells in the vaginal tissue. And so this virus, if it's not going to go away and clear out of your body easily, it can be persistent and cause abnormal cells over and over again. And so there's women being tortured by this, really being tortured by a virus there is nothing then that the standard medical system can do besides just remove abnormal cells. And so women are going through repeat procedures, and if it leads to cancer, then they have to go through chemo and radiation. It's a lot. It's a lot that women are going through. And I get very passionate about it because as a naturopathic doctor who specializes in women's health and as a midwife, I was trained to address HPV more than 25 years ago. And so I've been helping women all this time and fine-tuning my protocol because I came into it. I was trained, okay, there's some natural ways we can help get the abnormal cells to go away. There's some ways we can help prevent it from progressing. But what I learned along the way is that there are things I can help women to do that actually helps clear the virus, that actually gets the virus to negative and not just temporarily. But I have cases where women have worked with me and now they are staying negative for more than 15 years.
Wow. Amazing. We're going to talk about some of your practices in the second half when we go to practical tips. And so I can't wait to hear, how you're able to help people clear it. And it gives people so much hope, I feel, because it is, like you say, it's a lot of stigma around this. It's almost like a death sentence. You think, am I going to get cancer? So I love that you talk about that there's a way for you to heal the body and clear this virus. And so talk to me a little bit more before we go into the second half. Is standard Western medical treatment for this just to do the LEEPs and to cut it out? Is there anything else that's recommended in the Western system?
Well, they're likely to mention the vaccine, but the vaccine doesn't, once you already have the virus, the vaccine isn't going to work. The vaccine is for preventing if you were to expose to a different type of the virus. When you do the procedures, say your pap shows abnormal cells. Now, if it's mildly abnormal cells, what we call CIN1, there's no treatment. We usually the doctor will say, come back, usually in 6 months, to recheck it and see if it progressed. So it's really a wait and see game. If it's CIN1, let's see if it goes away. If it progresses to CIN2 or 3, that's when the doctor will suggest we need to remove those abnormal cells. And the most common procedure used at this point in time is called a LEEP. In other countries, they call it a LETS procedure, but it's the same procedure to remove the abnormal cells without removing part of the cervix or without removing the uterus. There's also a procedure called conization or a cone biopsy where they do remove part of the cervix that doesn't grow back at that point. And so it's essentially removing the abnormal cells. So those are out of there. They can't progress into cancer. But because the virus is still there, a lot of women who contact me find that within 6 months, so you could have, I just talked to a woman this morning, she had a LEEP 6 months ago and then got a new pap, that removed those abnormal cells. She had another pap 6 months later and the abnormal cells are back again. So now she's in the position of the doctor saying, now you need another LEEP. And that's when women are like, wait a minute, what's going on here? And I'm glad that women are more empowered to say that. And sometimes women are feeling, very angry, rightfully so, to say this is not okay. And I don't think it's okay either. But the thing is that that's how the standard medical system, that's all they can do, because really what I find as the effective approach that we're going to talk about is a holistic approach. It's about looking at the whole body. It's about considering our whole environment, our diet, our microbiome, our hormones. And that's just not in the toolbox of standard medicine. So it's no wonder that they're not offering that as a solution, because that's not part of their training. So I always encourage women to know, like, it's just that when you go to a standard gynecologist or any kind of standard practitioner, you have to know that their training is to do the test and do a procedure or do a surgery. That's their training and that's their tools. We can't expect that they're going to have different tools because they weren't trained with different tools. Now, occasionally I'll hear, thankfully, that some people will say, oh, my doctor said take this multivitamin or take this product, which I'm so glad that doctors are starting to integrate that. And I really hope to be training more practitioners in my protocol in the near future, because I would love to transform the way that medicine is there for women. I really believe this should change in the near future so that women are not having to deal with this one on their own, and not having to search the internet for answers, and not having to deal with cervical cancer and find out that there's something they could have done about it that their doctor didn't tell them about.
For sure, for sure. So talk to us about the drivers of this. You were telling us about your patient recently that had a leap and then it came back. So do we know what's driving this to come back?
That's exactly the question I ask. When I'm helping women, I say that, like, what is making this person susceptible to this virus? Because we know the human body can deal with it. We know the human body has that capacity. Why is this person's body not able to? And it's by asking that question, why? What's going on? And I go through systematically the possibilities, because, and it can vary from case to case. It's not the same for every woman. And sometimes it's multiple factors, right? It could easily be nutrient deficiencies. A lot of women, when I do the testing to identify, I find they may have iron deficiency or B vitamin deficiencies or vitamin D deficiency are really common, but there can be other nutrient deficiencies. And then we have to say to ourselves, why do they have nutrient deficiencies? Why is it a dietary deficiency where they're just not getting these nutrients? Is it a digestive, not digesting the food well, not absorbing the nutrients well? Is it also because they're depleted? Like maybe women who have heavy periods, they're becoming, if not anemic, low in iron and B vitamins because of the heavy periods. Okay, well, it's not enough to just give iron. We have to solve the heavy periods so that they don't continually lose their nutrients, right? So I start like that. I start to be a detective and say, what's really happening here in her whole body that then is leaving her vulnerable? Are there hormone imbalances, estrogen, progesterone, or really what I find is any hormone imbalance? If there's thyroid underfunctioning, if there's insulin resistance or blood sugar issues, is there cortisol, high or low? And really cortisol is our main stress hormone. And what I find consistently through my patients over the years, when I ask women who are testing positive for HPV and maybe abnormal cells, and I say to them, have you been under more severe stress in the past year or 5 years? And they consistently report that they, yes, have had more stress. That could be that they had a very stressful job, or maybe they were in graduate school, or maybe they were in a very stressful relationship or a divorce, or maybe they had a loss of a family member or 2 family members, a death in the family, a fire in their home, these stresses that can happen that then end up causing disruptions in our bodies, because we know that when we're under severe stress, it's likely that our cortisol is going to go too high or too low. And once that cortisol is too high or too low, it causes a ripple effect through the body, right? It can cause then the digestive issues and leaky gut, imbalanced microbiome. The imbalanced microbiome in the gut causes an imbalanced microbiome in the vagina. And we know that imbalanced microbiome makes HPV more likely. So I can then connect the dots between the stress exposure on this nutrient deficiencies and imbalances that develop, including suppressed immune function. When we're under stress, that our immune system is not optimally functioning, and we are much more likely to be susceptible to all sorts of different infections, including HPV. So what I find is when I look at it from this perspective of stress, it all makes sense. Okay, no wonder this person has HPV testing positive at this point in their life. They just came through major stress. But it's not enough to just say, okay, just decrease your stress, because a lot of times stress is part of their life. So yes, we can do our best to minimize our stress. But to me, the solution really lies in helping women to recover from stress.
I love that. And I love that you've written a book all about this. So I would love to talk about that. Master Your Stress, Reset Your Health. So tell us about that. Can we learn some really good strategies for managing our stress by reading your book?
Absolutely. That's what it's all about. And I wrote this book, the Master Your Stress, Reset Your Health book, because I feel like every human out there needs this information, because this ultimately is the driver of all health issues. Because I consider stress to not just be psycho-emotional stress, but I would say stress is even toxins in our environment, whether it's mold toxins and our other environmental toxins, including relationship toxicity is a stress. Also stress from just imbalanced blood sugar, lack of sleep. There's so many stress, even stress from exercising too intensely or fasting too long. These all can become a stress response that then signals toward health issues. And not everybody under stress is going to end up testing positive for HPV. Some people, then it leads to other health issues, whether, like for me, it was migraines for many years, until I really figured out how to solve all of my stress factors and fully recover from all of my stress exposures. Then the migraines went away. Other person, it might be anxiety, depression, or skin issues, or gut issues, or all of the above, autoimmunity, right? These things research shows us stress is what triggers them. But I think what's missing in a standard approach is, just, manage your stress, whatever that means. And a lot of people are like, how am I supposed to do that when I have to keep up with my job, my family? It's like feels impossible. And so what I do in this book is I break it down in a way where it's doable, where you can then understand how the stress is affecting you, and start to be proactive about creating a daily routine that integrates the stress recovery in a way where it's not stressing you more.
I love that. It's amazing. And I always tell people, stress is one of the leading causes of fertility issues. And I would say even health issues in general, as you just pointed out. So what an amazing resource. I think that everybody should read this book, and it can really help a lot of people. So thank you again for writing it. That's amazing. And we are going to take a short break. We're going to go hear a word from our sponsors, and we're going to come back and we're going to talk about the practical tips that we discussed earlier on how we can put HPV into remission and live a holistic life. So we'll do that and more when we come back.
Hey y'all, it's Dr. Kayla here. I hope you are loving this episode as much as I am. We will be back shortly, but first, let's hear a word from our amazing sponsor. Trust me, it's something you'll definitely want to hear, especially if you're passionate about fertility and hormone health. Did you know we have our exclusive herbal tea crafted especially for fertility, hormones, and reproductive health? This isn't just any tea. It's a nurturing blend of 5 potent herbs, each chosen for their unique ability to support fertility and hormone balance. Imagine the benefits of red raspberry, nettles, calming chamomile, antioxidant-rich green tea, white peony, and the delightful rooibos vanilla, all in one soothing cup. This delicious, nutritious tea is perfect for starting your morning or relaxing in the evening. So why wait? Head on over to our website, www.hormonepuzzlesociety.com/fertility-tea to support your fertility journey in the most natural and enjoyable way. Now let's get back to our insightful episode and continue our hormone puzzle journey together.
Hey, Dr. Doni, welcome back.
Thank you.
So let's talk about those practical tips that we alluded to earlier. What are some things that we can do to put HPV into remission?
So one is to start asking yourself, what's making me susceptible to HPV at this point in my life? You know, like really start to check in with yourself and be honest with yourself. I mean, the thing is that one of the things I see with women who are dealing with HPV and abnormal pap smears, especially, is there's a disconnect with ourselves. And I'm sure that other listeners as well may resonate with this, is like, as women, I think in this in particular, we're so used to paying attention to other people, and we're taught, oh, we need to take care of everybody else. We need to be doing what everyone else thinks we should be doing, right? We're very focused on what other people think and serving others, which is beautiful, but we end up not focusing on ourselves and not taking care of ourselves and actually getting disconnected from ourselves. And so when women get this test result back, they often then find themselves in a spiral of being hard on themselves. Again, why did this happen to me? What's wrong with me? Is this going to cause cancer? Is it going to ruin my life? And it becomes this anxious spiral. And so I want to help you. One of the first things I find is solving that, help you reconnect with yourself and your ability to heal. Your body does have an ability to heal. You didn't do anything wrong, and you can solve this going forward. And so sometimes the first step is getting that mindset and that reconnection with self back, and to realize I'm worthy of help. I'm worthy of healing, and I'm worthy of the self-care and prioritization that it takes in order to heal. And so, you know, if that could be one of the first things for you, is to really sit with that and say, hey, how can I really put the focus back on myself? How do I sit down with my daily routine and honestly say to myself, do I even have 10 minutes for myself? Sometimes it's even hard for women to take a shower, let alone be able to buy foods that are healthy for them and make sure they're getting to bed at a healthy time, and, figure and to be able to choose to invest in having a practitioner like you and I help them, right? So really it takes sometimes that loving kindness, practice of loving kindness, to start to realize that you are a good person and you do deserve help and support with this. And then you can then more likely to choose into, okay, who can help me? Because it can be like, a lot of times women are searching online and you might come across various products. A lot of times people come across, for example, AHCC, which is a standardized extract of shiitake mushroom. And that's wonderful. I love mushroom extracts. They are very powerful with the immune system. They do have some effectiveness against HPV, but again, it's not 100%. So I will warn women, yes, take these strategies, but recognize that with HPV, especially chronic HPV, taking one substance is likely not enough. Right? It's not enough to say, oh, I'm just going to take AHCC, or I'm just going to take a little bit of, like, let's say there's some supplements that have a little bit of folate and a little bit of selenium and zinc in them. For some percentage of people, that might be enough. But if you try that and it's not going away, we need to think bigger, right? We need to get to that big picture where we say, wait a minute, maybe this is not just about taking some mushroom extract. Maybe this is, I need to sit down and really look at my health and how the choices I'm making are affecting my health. I was talking to a patient yesterday where, she decided to work with me because she got to a point where she's like, I need help implementing this. I've already tried AHCC. It's not going away. And we start to look at things and we start to realize, she was still smoking some cigarettes. And we know that cigarette smoking, it does increase risk of HPV. So how do I really help her to get to the point of not going toward those cigarettes? Because what she shared with me is that she was thinking that smoking cigarettes helped her when she felt stressed, right? Like we get in our mind, oh, this is what I do when I feel stressed. And what she said to me yesterday was she now realized that's not true. That the cigarettes were not actually helping her with the stress, that the cigarettes were just making her think that they were helping, but they were actually making her susceptible to the virus, right? And instead, now she's been implementing based on, yes, my book and others. And what I do is I then help patients to test their cortisol levels, their adrenaline levels, their serotonin levels, and actually see what the stress is causing and actually help them recover from stress based on their real physiology, not just nicotine, but hey, is there low serotonin? Let's address that. Hey, is there high cortisol? Let's bring it down. Like, let's see what's actually happening and give you the actual nutrients and herbs that will help with that. So she's been implementing that for a couple months now, and she's starting to see the difference where she can say, wow, she can actually see that it's possible to not have to be in a high stress experience constantly, and that the cigarettes weren't helping her. And now it's been 2 weeks since she stopped smoking.
Wow.
And that's the kind of case where I just get goosebumps. I'm like so excited for her transformation because it really is a transformation. She said that her family is saying, whoa, we've never seen you make such amazing changes to support your health ever before. And so she's getting this positive feedback, and it's because she's each day putting one step in front of the other, and her main guiding purpose is she wants his HPV gone. It's a very motivating purpose, right? Like, I want HPV gone. I'm going to do what it takes. I'm going to even face some things that have been hard for me to face, and face some limiting beliefs that I may have had that are no longer serving me, and create new beliefs such as my body can heal and I can choose to prioritize myself and give myself the care I need in order to heal. And sometimes those are hard choices for women to make, but I'm telling you, when they do, we start to see amazing things happen. Not only does the HPV go to negative, but they start to feel better about themselves and their life, and they're preventing all different health issues at the same time. And you mentioned fertility. I see women who are following my protocol, they get pregnant so much faster. Like, a lot of times they get pregnant. I even have to warn them and say, by the way, while you're following my protocol, you are increased likelihood of getting pregnant, because it happens so often that they're like, oh my gosh, I just got pregnant and I wasn't even trying. Because of course, the same things, when we apply these steps, that fertility improves, ovary function improves, hormones are balanced, nutrients are balanced. So, and stress comes down. I mean, of course, if we're under stress, that turns off ovary function for women. So no wonder, as I help them to really solve their stress hormones so their body can function without being in a constant stress mode, the ovaries are like, oh, okay, you want me to ovulate and make estrogen and progesterone? I can do that. And so then pregnancy happens a lot easier when we get to that place.
Amazing. I love that. And those are the best client stories. It never gets old when a client gets results, and it gives me goosebumps too. So I love that story, and good for her for stepping up to the plate and putting those cigarettes down. That's amazing.
Yeah.
I love that. Well, let's talk about nutrition for a minute, because nutrition, plays such a huge role in the body, as I'm sure you know as a naturopath. Is there a certain nutrition, I don't even like to use the word diet, but approach that we should adopt as we're trying to fight HPV that will help us, with the overall protocol that you prescribe?
Definitely. The first thing I would say is to just really get clear about sugar, because of course when we're stressed, sugar becomes a quick addiction, right? It makes us feel good temporarily, and then it makes us want more of it. The problem is that sugar, I'm talking about regular cane sugar or a spoonful of sugar or the many other forms that it comes, it lowers our immune function. So as soon as you eat sugar, your immune system is down for 8 hours. You're much more susceptible to HPV that whole time, and we're having sugar probably more than every 8 hours. So first of all, I would just say just stare that sugar in the eyes and be like, okay, I'm the one who's deciding now, and you get to decide whether you want some sugar or not, but be aware that that sugar is making you susceptible, and there's many ways that it sneaks in so many ways. Sometimes just by looking at the labels on our foods and our beverages, we can reduce our sugar intake drastically, very easily. And so that's a big one I start with, is like, let's look at that. I mean, alcohol also is important because alcohol also drops our immune system. So if you have been drinking more alcohol recently, I think it's worth looking at that too and say, hey, is this, even if it's one drink every single day, that's likely too much for a woman's body. So just, again, you have to kind of consider these things and say, is it really worth it for me to be consuming a substance that's working against my health? And not to say that you should have to have zero alcohol or zero sugar, but sometimes we just need to get your body back on track first, and then choose, okay, do I have a little bit of this substance, knowing that I can handle it now? And then the next area that I really find is important to look at is food sensitivities, because what I've identified is that there is an absolute link between leaky gut and abnormal PAPs and HPV. And that's not the first thing you would think, because we're talking about the cervix and we're so used to sort of thinking of our body in separate parts and separate areas and separate doctors. But actually what I find is when I help women to identify and heal leaky gut, that they're way more likely to have the abnormal cells go away and the HPV go away. And so I can see that connection, absolutely. And so what I recommend is if you're going to at least start with what might be considered like an elimination diet, where you eliminate the most common food sensitivities, which would be gluten and dairy. You can start with that, and because you may not realize, like, these food sensitivities are delayed reactions. They don't cause immediate symptoms. They're very sneaky. So you usually would have to avoid those foods for at least 3 weeks to even get a sense that it might be. And even with abnormal PAP, it's going to take much longer to put the connection. Oh, this food was making me susceptible. So what I recommend is doing a very accurate, high quality food sensitivity panel. You have to be very careful because there's a lot of companies that offer food sensitivity panels, and they are not created equal. They are not all going to give you accurate results. You might be doing a food panel and get information back and you're just like, I don't know what to do with this. So I've just researched these labs for more than 20 years, and I know exactly the lab that gives me the accurate results. So that's what I recommend, is do the food sensitivity panel, IgA and IgG, from a very highly specific, accurate lab. So you're getting results that are going to give you the right information about which foods are triggering an inflammatory response. And it's not just about avoiding foods and restricting your diet. It's about identifying leaky gut. If you're reacting to foods you're eating often, that's the definition of leaky gut. So then we can start implementing. Okay, is it mild, moderate, or severe leaky gut? Let's start avoiding the high reactive foods that are perpetuating it, and let's start implementing the herbs and nutrients that will heal it, so you can actually get ahead of leaky gut. Leaky gut can heal, but you have to have a good strategy that's going to work. And it just so happens I've been helping people with that for so many years, so I already have a leaky gut protocol that I could say, let me implement this with my HPV patients, and lo and behold, it's helping them heal faster. So I implement diet changes that are going to be dropping inflammation and helping to heal leaky gut, as well as to optimize the microbiome. Because, the thing is, what I would say is that so often we hear, take more probiotics and more fermented foods. But what very often I identify is that we actually have an overabundance of bacteria. We don't actually need to put more in or feed them more. A lot of times we need to feed them less. And so being able to understand that, is there an imbalance or overgrowth of the microbiome, like SIBO, or even overgrowth in the colon? Is there vaginal yeast and BV? Then that means the environment's out of balance. It's not just about throwing in more probiotics and more fermented foods. We gotta address this. We need to get rid of who's overgrowing and start actually making sure that you're feeding the right bacteria the right amount. So these are, just to give you a sense of like, these are the areas that I look into. And it doesn't mean that everyone needs to do all of this, but we need to be able to sit down and say, hey, is this happening for you? If so, let's address it, because the longer it stays that way, the more health issues it's going to develop.
For sure, for sure. And I love that you mentioned that, because these are some of the same places that I look when I'm looking for fertility issues. And I think definitely leaky gut is one that's underdiagnosed. And so for people listening thinking, well, what even is leaky gut? Can you briefly tell us what that is?
The way I explain it is, think about our digestion, everything from the minute you swallow food through your esophagus, your stomach, your intestines is a tube, right? It's a tube through your body. And that tube is made up of cells that are, what we call the intestinal wall, but really they're the wall of a tube that's running through your body. And that tube, those cells that make up the tube are lined up right next to each other. They're just amazingly, our body lines up these little cells next to each other, connects them together, and we regrow those cells all the time. The intestinal lining replaces itself, I think, even every 5 days or something. So this is if you think about it, it's a living, changing environment, and our body has the ability to make new cells. But what happens is, when our digestion is bombarded, right? Bombarded with stress, emotional stress from our life, as well as toxins, even pesticides that we might be swallowing, or having too much coffee, or taking medications that damage the intestinal cells, like proton pump inhibitors, like acid blockers, antibiotics. So many medications end up damaging those cells, as well as gluten in our foods. Too much gluten, which is in barley, wheat, rye, and spelt, damages the cells. So now our body's trying to keep up making new cells to maintain this intestinal wall. But if we are constantly damaging it, sometimes our body's like, I can't keep up, especially when we're stressed. So now the intestinal cells are not as healthy as they should be. Those intestinal cells, their job is to make sure that our food is digested and only our nutrients get through. And our immune system's sitting right on the other side, prepared to defend us from anything that shouldn't be there. So what should happen is our food comes in, it gets digested, our intestinal cells make sure everything's digested and only lets the nutrients in. When it's leaky, when there's microscopic deficiency in intestinal cells, now undigested food, because we don't digest our food well when we're stressed, undigested food can leak through. So it's leaking, and people say, where is it leaking? It's not that it causes diarrhea necessarily, but it's undigested food leaking between the intestinal cells. And when it leaks between the intestinal cells as a piece of food, like as a banana or as an almond, it still looks like a banana or an almond. It didn't get digested. The immune system is doing its job, and it's like, what's that? I don't know what that is. That's not glucose. That's not amino acid. What is that? And it's like starts attacking the banana or the gluten or whatever the food is you ate. And so now the immune system is putting in all this effort to protect us from our food, even what we might consider healthy foods. It's protecting us from, because the food is leaking through and getting into a location where it shouldn't be in the first place. And so it's about, understanding that. And then that inflammation that the immune system creates doesn't just stay in our gut. In fact, 50% of people who have leaky gut have no symptoms. They could say, I say, how's your digestion? And they're like, I feel fine. I have a bowel movement every day. I don't have any heartburn or bloating. 50% of people have leaky gut and they have no idea based on their digestive health. But that inflammation travels through the body. The inflammation can cause sinus inflammation, headaches, skin rashes, can even lead to things like PCOS and fatty liver, and certainly can lead to increased risk of HPV. So it's like, what started in your gut as just the effects of stress and not getting your nutrients digested ends up in this full-blown even autoimmunity because of, no one's identifying. It's not identified in a standard medical blood test. It's not identified even in a standard, you can't see it on an endoscopy, so your gastroenterologist is not going to tell you about it. The only way we identify it, there are some leaky gut tests out there, but honestly, what I find over years of doing these tests is my best way to identify leaky gut is with a very specific food sensitivity panel, because then I can see if a person's reacting to the food they're eating it means the food's leaking through. And so I can see right away, oh, there's leaky gut. We need to start healing it. And there's a lot of, I think, misconceptions about how to heal leaky gut. And I just tend to be a kind of person who, as you can probably tell already, I tend to be like, let me do what's most efficient and most strategic. And so that's how I help heal leaky gut.
I love that. I love that. And I could talk to you all day, but we do have to start to wrap up. So definitely want to tell people, well, before we wrap up, I want to play our little game that we talked about earlier. So if you're open to that, I want our audience to learn about you personally. So let's do that really quick. So I'm going to ask you a series of questions. I just want you to say the first thing that comes to your mind.
Okay.
Favorite food?
I would say one of my favorite foods is arugula. I have it almost every day. It's one of the things I look forward to the most. I always have some in my refrigerator. I don't know if you want me to tell you more of why, but I would say arugula is one of my favorites.
I love that. I love that. And arugula is also one of my favorites. I love, that's my favorite lettuce. I love it. So, and so least favorite food.
My least favorite food, I would say, is oysters. And it's not to be negative about oysters, but it's just my preference. I don't tend to like slimy, slippery, squishy foods.
There. Favorite hobby?
My favorite hobby is ballroom dancing. I'm a competition level ballroom dancer.
Amazing. That's so funny. The guest I had before you also, her hobby was dancing, but so dancing's our theme for today. I love that. One thing you're scared of?
Gosh, let's see. I often tend to look at things I'm scared of as like challenges. Like, okay, we're going to face things that we're scared of all the time. And how do we work through that? I would say that probably one of the things I'm scared of is just like, I suppose something that could destroy my home or my family, something like that. Because, I put so much into and I care so much about them. I wouldn't want anything to happen.
For sure. And then something or someone that you love.
Well, I have a 21-year-old daughter and a 1-year-old granddaughter, and they are just such my loves. They motivate and inspire me to do what I do every day. And so, yeah, it's so beautiful to be able to be a grandma and get to support them.
I love that. And then last question, your favorite quote.
Let's see. My favorite quotes tend to be about how we have the ability to heal. And so it's like, I'd say it would be a quote that would be something like, you have all the power within you. You might not realize it, but you have it. And it's just about connecting with it and letting it happen, letting it work for you.
I love that. Amazing. Well, tell us where we can find you and learn more about working with you, and where can we get your amazing book?
Well, my website is drdoni.com. So Doni is D-O-N-I. So just go DOCTORDONI.com. I'm also on social media as Dr. Doni Wilson, D-R-D-O-N-I Wilson. And my book, this Master Stress Reset Your Health book, is on Amazon, also as an Audible book. So if you're more likely to listen than read the book, then that's also an option. And yeah, I would love to hear from any of you if any of this resonated and you want to learn more and you wonder if I can help you, please don't hesitate to reach out.
Amazing. And any final thoughts, any piece of advice you want to leave us with?
I'm just so glad that you're offering this podcast and that the listeners are listening to this information and starting to take these pieces of information to see how it resonates and gives you some more. You call it the puzzle. I love this concept of a puzzle, because I often feel like what I do as a practitioner is help people solve the puzzle of their health, and a lot of times when someone's been dealing with health issues for a long time, I say it's because we don't have all the puzzle pieces. So many people are trying to solve the puzzle without they're missing pieces. So I'm like, First of all, let's make sure you have as many pieces of the puzzle as you can so that you're more likely to be able to solve it, right? It would be much more easy to solve a puzzle if we have all the pieces. So, like, invest in yourself and say, okay, let me find a practitioner who can help me get the information I've not had, like a food sensitivity panel from a highly accurate lab. That's a huge puzzle piece. If you don't have that, it's going to be hard to solve the puzzle. Or do you have your cortisol levels from morning, midday, evening, bedtime? If you don't know your cortisol levels, that's a big missing piece of the puzzle. It's going to be very hard to solve your health issue without that. So I look at these being able to invest in, yes, these are usually out-of-pocket specialty labs, but being able to invest in an out-of-pocket specialty lab to get information that helps you solve your health puzzle is priceless, is priceless. So I just encourage you to say, I'm worth it. I'm a priority. I understand that the healthcare system, what they offer and what they don't offer, if I want to be taking care of my health, I need to invest in getting the information I need and the support then to implement solving whatever it is you discover as you solve your puzzle.
I love that. I completely agree. And that's one of our themes here. Just be your own advocate and you have the power to solve this. So get all the puzzle pieces and make that happen. So I love that you say that. And thank you so much for being here. You're just a wealth of knowledge and I really enjoyed this conversation. So thank you.
Thank you, Kayla. I'm really enjoying it as well. I can't wait to hear from your listeners.
Yes, me too. And thank you, listeners, for listening to the Hormone Puzzle Podcast. We'll see you in the next episode. Bye for now.
Hey, hang on a second. Before you go, I've got some fantastic free resources waiting for you over at our website. You can find that at www.hormonepuzzlesociety.com. You'll find everything from a fertility meal plan, a cycle optimizing quick start guide, even a pregnancy meal plan. Plus, there's masterclasses and blog posts from myself and leading experts in the fields of fertility, hormones, and nutrition, all designed to support you on your journey. And I wish there had been something like this when I was going through my 2 years of unexplained infertility, but there just wasn't. That's why I put all of these resources together for you. So make sure you go and check these out and make the most of the support that I've arranged for you. And here's a little secret. These are the same strategies and foods that helped me conceive not once, but twice, even after my doctor said that I couldn't. So I know that these things work. Make sure that you take advantage of that. And I can't wait for you to be our next success story. Thank you so much for joining me. Remember to visit our website at www.hormonepuzzlesociety.com for the show notes of today's episode. And if you've enjoyed our time together, please subscribe and leave us a review. I so appreciate you and thank you for being a valued listener. See you on the next episode of the Hormone Puzzle Podcast. Take care and lots of love.